Hi, my name is Abou-Chedid, and I'm a urology consultant specializing in robotic surgery for prostate cancer. In this video, I want to explain what Retzius-sparing prostatectomy is, how it differs from the standard approach, and most importantly, how to choose the right surgeon for you. Retzius-sparing robotic prostatectomy is a specialized way of removing the prostate. In the standard operation, the surgeon approaches the prostate from the front, between the pubic bone and the bladder. In Retzius-sparing surgery, we approach the prostate from behind, working between the bladder and the rectum. This allows us to avoid entering the Retzius space. That space contains important ligaments and support structures that help control urine. By preserving these structures, men usually regain bladder control much faster. Studies have shown that continence recovery can be up to twice as fast compared to the standard robotic approach. Retzius-sparing surgery is therefore particularly valuable for men who want the best chance of early continence, who are active or working, and who want to return to normal life very, very quickly. When this approach is appropriate, it offers several advantages. It preserves the natural pelvic support, it reduces tension on the bladder neck, and it gives excellent visibility for nerves preservation. And cancer control is equivalent to standard robotic prostatectomy. There are also other important benefits, which are that men have a lower risk of developing an inguinal hernia after the surgery, because the front of the pelvis is not disturbed. There is also less reduction in penile length after the surgery, which is increasingly recognized in the medical evidence. These are important quality of life outcomes, and recovery is usually very straightforward. Most men only stay in the hospital for one night after the procedure, and I personally use a suprapubic catheter that goes into the tummy through the bladder rather than inside of the penis itself, and most men find this much more comfortable. I will remove the catheter myself 7 days after the procedure, and continence recovery is usually very early. In my practice, around 84% of men are dry on the day the catheter is removed, and 98% are continent within 3 months of the procedure. Most men return quickly to work, exercise, and daily activities. Choosing the right surgeon is one of the most important decisions you will make. The surgeon's experience matters more than the robot model or the hospital where you are having the procedure. Questions that you should ask your surgeons are: how many robotic prostatectomies do you perform each year? Did you specialize in Retzius-sparing robotic surgery? What are your continence results at 3 months after the surgery? And how often do you perform nerve-sparing prostatectomy? Every robotic surgeon in the UK has access to verified outcome data through the Model Health system, and you are absolutely entitled to ask your surgeon about their results. If you're considering robotic prostatectomy, take your time, get informed, and choose a surgeon whose outcomes are consistent, transparent, and supported by patient experience, which you can easily find using platforms like Doctify.